Why is a CORT scan used to diagnose TB? Imagine trying to see tiny details in a busy city skyline. A chest X-ray gives you a general view, but a computed tomography scan offers a much clearer, detailed picture of the lungs and surrounding tissues. That's why doctors often turn to a CORT scan when they suspect tuberculosis. It provides high-resolution, three-dimensional images that help reveal small or early lung lesions that might not show up on a standard chest X-ray. These tiny lesions are important clues because they can indicate the presence of tuberculosis before the disease becomes more advanced. A CORT scan can also detect how the infection has spread through the lungs and airways, showing patterns like bronchial dissemination or miliary tuberculosis, which are often difficult to see on regular X-rays. It can identify enlarged lymph nodes in the mediastinum, the central part of the chest, which are common in tuberculosis infections. This detailed view helps doctors confirm a diagnosis, especially in tricky cases where a chest X-ray appears normal but clinical signs suggest tuberculosis. In children and infants, airway complications like narrowing or bronchial involvement are more common, and CORT scans are better at visualizing these issues than traditional X-rays. They also help in planning further procedures like biopsies or bronchoscopy by showing exactly where the problem areas are. While chest X-rays are usually the first step in screening for tuberculosis, CORT scans are used when more detailed information is needed to understand the extent of the disease or to clarify ambiguous findings. It's important to note that in some countries or situations, CORT scans are not used as the initial test because they are more expensive and involve higher doses of radiation. Instead, they are reserved for complex cases where the disease is suspected but not clearly visible on X-ray, or when complications are suspected. Overall, the main reason for using a CORT scan in tuberculosis diagnosis is its ability to detect early, subtle, or complex lung abnormalities with much greater clarity. This helps healthcare providers make more accurate diagnoses and decide on the best treatment plan. Always remember, if tuberculosis is suspected, consulting a healthcare professional is essential. They will determine the most appropriate tests based on individual health circumstances and local guidelines. A CORT scan is a powerful tool that complements other diagnostic methods, ensuring a thorough understanding of the disease's presence and severity.